Welcome to the Optimal Life podcast. My name is Elliot Barnett, and I'm excited for you to be here with me today to learn to help others or help yourself live an optimal life. In today's episode, we're going to cover a really important topic, history of the mental health industry. This is very important because we are all about being agents of change in the new era of mental health. We want to see the mental health evolve to be more affordable, accessible, and effective. To understand how we got here and why this is so important, we have to understand a little bit about the history of how we got here and how the mental health industry evolved over time. And obviously, this could fill volumes in a book in hours of time to go through a thorough history. So I'll just kind of touch on the high-level points. But we really want to see the mental health industry evolve towards something that's going to genuinely help people live an optimal life. And if you look at, we all recognize and understand the mental health industry is challenged right now. And it's not that people aren't getting help at all, but if you look at, let's say, the effectiveness, if you think about and look at the history, even in recent decades, people aren't doing all that much better. If you compare that to the medical industry, there's been incredible advancements in recent decades with physical health. People are living longer, people living healthier. Of course, people's lifestyle has to do with that, but medical interventions have made tremendous progress. Now, it's not that the mental health industry hasn't progressed, but people are still struggling a tremendous amount, and the statistics, just Google it, you'll see that the statistics don't lie. There's something not quite right if we're making advancements in the mental health industry, but there's almost this pervasive nature of mental health challenges that people are facing. People are being diagnosed with these disorders, illnesses, and diseases almost ubiquitously. Everybody has a diagnosis. What is going on? We have to scratch our head a little bit and understand, why is this such a pervasive problem in our society? Why are people struggling so much? And what do we do about it? Now, that's what we're here for. That's why we have the certifications over at elliottbarnett.com with CRT and the ARRATE framework. That speaks to the effectiveness. We're ushering in better approaches that help people in a much more effective way at a foundational level so that they can live their optimal life. Now, accessibility. How is it more accessible? Well, we're building technology platforms. My background is also in technology. So we are addressing accessibility through better technology means to reach people more effectively and empowering coaches and mental health professionals to be able to collaborate and work with their clients more effectively on their mental health journeys. Now, affordability, looking at different options to subsidize those that can't afford mental health help. So all this put together, we are empowering the new era of mental health to make it more affordable, accessible, and effective. But again, to understand why are people struggling so much and why is the mental health industry such a mess, we have to look at a little bit of the history of how we got here and how do we move forward in a more of a positive way. So I got some notes here because I want to make sure I get these facts right because there's a lot of information. But you can imagine, if you think back, if you imagine yourself, project yourself back a couple thousand years, and you were exhibiting symptoms of some type of mental health problem, it would be a scary thing. You would potentially be accused of some type of God cursing your family. You might be attributed to some type of demonic possession. So now you're being exorcised of demons. You could have literally holes being drilled into your head to let out blood to alleviate these mental health symptoms. So all these terrible things probably would follow if you exhibited mental health problems. Even things that people would consider not so dramatic today would be treated as such. The interesting thing happened when this was in the 4th century BCE when Hippocrates came along and he identified what was called the 4 humors. The 4 humors, it was the first attempt at identifying something biological, not the demonic possession or some angry god cursing your family, but something that was actually inside the body that was causing these mental health symptoms. The 4 humors were blood, yellow bile, black bile, and phlegm. the idea was that one of these four substances or more were either off or missing inside the body, which would then manifest as physical or mental health problems. Shockingly, this pretty much stayed in some flavor of sorts from all the way from then until the 1850s, when the germ theory of disease was introduced in the 1850s. So that's a really long time to have not a lot of progress in the mental health industry or how mental health was treated. There really wasn't a lot of innovation going on. But something really interesting happen in the 1800s. They introduced what was called the moral treatments, which I think was super fascinating. The moral treatments was the idea that maybe people that were in the asylums and struggling with their mental health, what they actually needed were things like exercise, sunshine, a clean environment, purpose, value, those types of things. It was the first idea that maybe people could be rehabilitated and even integrated back into society and with their families. So they cleaned up the asylums, they gave them some fresh air, some exercise, they focused on occupational needs. So it's pretty interesting that they started to recognize the need for that. But this also started to draw this dividing line between the biological and the psychological. So there were either biological causes to mental health problems, or there were psychological causes to the mental health challenges. Now, of course, when we entered into the 20th century, there was the introduction of psychoanalysis, arguably founded by Sigmund Freud and his contemporaries, of course. So this was interesting because then this was, again, the first time that people started sitting down and thinking, if we examine your past and look at your lived experiences, maybe that is the cause of the mental health challenges that you had. And if we can work through those together through talk therapy, then maybe we can move you beyond those problems. So again, a dividing line between the biological, the physiological, and the psychological. So, and at this time, there still wasn't any real way to categorize people that were exhibiting different mental health symptoms. There were broad categories like neuroses, for example, or psychoses. Neuroses being anything that didn't involve delusions, and a psychosis were more of significant breaks from reality. There were terms that they used like melancholy or mania to describe symptoms, but there really wasn't any formalized way of diagnosing people with any mental health challenge. Now, there was a growing idea that obviously there's something to do with the brain here. And so again, examining parts of the brain and their role with how people behaved or showed up in the world became a whole discipline. And one of the greatest examples I love, if you look it up, read about his case history, it's pretty interesting. Phineas Gage. He had a railroad spike drilled or sent through his skull, completely destroying his frontal lobe. You can imagine he had a pretty significant behavioral change. Went from a really hardworking, great family man to not doing so well, really unreliable, violent, and very erratic. So clearly, there was some role that the frontal lobe played in behavior. They just didn't know what exactly, but a lot of the research at that time was around traumatic brain injuries, because it was some type of injuries to some part of the brain caused some type of behavioral change. So then they started to try to build correlations between that part of the brain with behavior. So there was a lot of, again, growing science and research around the role of these severe traumas to the brain and some type of impact to the person's mental health. This led into more discoveries in what started in the 1940s with pharmaceuticals. This is fascinating to me. So the 1940s, they discovered lithium as having an impact on mental health, of elevating people's moods. This is what I would call a series of happy accidents. Why do I say that? Well, I say happy accidents because they were actually researching, in the case of lithium, they were looking at lithium urate. Now, they knew at the time that the body operated as in metabolism. Meaning the body had a lot of metabolic processes, and the idea was that these metabolic processes had byproducts, and that was causing these manic depressive symptoms, which later turned into what they call bipolar. The idea was that these metabolic byproducts were causing mental health problems, so they thought this lithium urate would get rid of these toxic byproducts. But what they realized is lithium in of itself had some calming effects on the patients. So again, it calmed people down. So this was an example of research being done, not finding the root cause to what they were trying to find, but identifying that medication, or part of what they were doing, that medication, as having some type of effect on mental health, the symptoms that they were experiencing. So this is obviously in stark contrast to physical disease. If you look at, say, like a cancer treatment that would either treat or at least stay off cancer progression, there's very targeted scientific research that goes on through various substances to see the effect on cancer cells, and then FDA approval, but this is a root cause here of understanding what the targeted treatments are going to do for the root cause, which is cancer. That's certainly not the case in this case. Now, another great example of that, even I think more illustrative, is what they did with antihistamine research. They were looking at imipramine, which was for antihistamine properties, the antihistamine properties of imipramine, and they realized that it elevated people's moods. So this was the first antidepressant. So again, this is a medication being identified for something for mental health that was, and the research had anything to do with mental health. So it's fascinating to me. So you had this growing field of psychoanalysis. You had this start of this pharmaceutical interventions, and of course you still had these medical interventions like electroconvulsive therapy, or ECT, which is still used today, and other sort of surgical procedures and other medical interventions that were being done to try to help people with mental health problems. Now, because this is really the start of the medicalization of mental health, we started to have a need to identify ways of diagnosing people in some type of medical way, which was had its real start in 1952's publication of the Diagnostic and Statistical Manual, or the DSM. So they published this as an attempt at categorizing and diagnosing people in some formalized way. So it kind of went like this: they would diagnose somebody with a category in the DSM. They would prescribe a medication or a medical intervention. They'd put them on some type of therapeutic setting, some type of medical intervention or some type of pharmaceutical intervention, and then get them in some type of therapeutic setting of some kind, because there was still a growing movement of psychotherapy at the time. The problem was that the public's belief in the medical intervention started to really grow. And the strong feeling that the mental health industry were curing things, or really understood the root cause to their mental health symptoms, therefore were curing the mental health disease, illness, or disorder, started to kind of grow in popular culture. And there is no better example, and I want to make sure I get this right, because this is the one that's plagues us today even. The chemical imbalance theory of mental health. So this started, and I'll see if I always mispronounce these medications. So let's make sure we get this right. So the chemical imbalance theory. So the development of antipsychotic medications like chlorpromazine, thank you, in the 1950s, and the antidepressants such as imipramine. This laid this foundation for this misunderstanding that led to this idea of the chemical imbalance theory. These drugs, of course, were found to alleviate symptoms of schizophrenia and depression, respectively. So chlorpromazine for schizophrenia and imipramine for depression. And it led researchers to hypothesize that these conditions were caused by specific neurotransmitters, dopamine in the case of schizophrenia and serotonin in the case of depression. So this started the idea of this you have a chemical imbalance, and what we're doing with these medications is correcting this imbalance and this biological abnormality, and therefore curing this disease that you have. And no matter how much research, later research found that to be an oversimplification of what was actually going on, and it still persists to this day. You still hear people today talk about they have a chemical imbalance and that SSRIs are somehow curing them of, say, depression. You know, that's not true. And they say, well, of course it is because I feel better, therefore that's true. And just because you alleviate some of the symptoms slightly does not mean you're curing anything. And I won't go into detail here because I want to do a whole episode on the metabolic nature of mental health. But what you're actually doing is helping in the metabolic dysfunction that the person's experiencing through increasing the serotonin availability. But anyway, the point is this idea that these medical interventions are curing something that they don't even know what the root cause is still pervasive to this day. But most practitioners today, they understand that, and if you talk to psychologists or psychiatrists today, they know that they're not curing a disease with these medications, that they're alleviating symptoms, and then most of the time they do prescribe, again, I'm using medical terms, prescribe some type of therapy for people to engage in to really help them. But the problem is that there's no consistency. So if somebody goes to one mental health professional, they might get diagnosed with a series of things within the DSM sort of categories. They go to another mental health professional, they get diagnosed with another set of categories. Could you imagine if that happened in the medical field? You went to one doctor, you get diagnosed with one thing, you go to another doctor, get diagnosed with something different, but then the treatments are the same? Just stop and think about that for a minute. You go to two different doctors, you get two different diagnoses, but the treatments are the same, because that's actually what happens. People get diagnosed with multiple mental health, quote unquote, diseases, disorders, or illnesses, and they get diagnosed with basically the same medications and basically the same therapeutic approaches. So something seems very off here, and we got to call these things out. We got to say that we need a better system. That's the whole point here, is we want to evolve the mental health industry. We don't just accept norms that have been the mainstay over centuries. We need to disrupt the mental health industry. We need to overthrow this mainstay and start to move us in the right direction. But this mindset of take a pill and feel better needs to be alleviated, and we need to stop moving away from this medicalized, DSM-centered idea of mental health. Think about this. The DSM started off in 1952 publication with about 128 categories and 132 pages. 128 categories and 132 pages. It is now in DSM-5, 1,000 pages with a 400% increase in the categories. 1,000 pages and a 400 increase in categories. My friends, this is outrageous to me. And I tell you, if you look at the DSM-5, I defy you not to find something in there that you could diagnose yourself with. So something is not quite right, and we need to affect true change in the mental health industry. And this goes as far as even the way that people label themselves and build it into their identity. I'm not going to go into detail about this right now, but even the terms like neurodivergent, I don't like those terms, because divergent from what? From what norm? I know that there are societal norms and cultural norms, but there is no one way to live live your life the right way. No one accepted norm, and if you deviate from that, then you're some deviant. One of the main tenets of cognitive response therapy is that mental health lies in a continuum. It is not about living an optimal life. Everybody's definition of living an optimal life is going to be different. What is your optimal life is not going to be my optimal life. It's not going to be somebody else's optimal life. It is your personal definition. So the idea is identify who you are now, who you want to be or need to be in order to live the life that you want, and then use the strategies taught in cognitive response therapy to close the gap. That's the whole idea. So when you hear people say, I have ADD or I am bipolar or my anxiety, those to me, it's very dangerous to label yourself and internalize these things as if they are permanent and pervasive parts of who you are. And nobody would say that if you got sick and had a cold. You know that that the virus is there one day, it's gone the next, and you can alleviate the symptoms while it's there. Then you have to work through it, and then it's not permanently part of who you are. We have to start looking at things a little bit differently as it relates to mental health diagnoses. Same thing with genetics. People say my anxiety is genetic, or I can't help it, it's just my genetics. This is a misunderstanding of the role of genetics in mental health. We know that it's all about the genetics and the epigenetics, how the genetics play out in the environment. So people can be predisposed to certain things or have a propensity towards maybe mental health challenges, but they're not determining factors. Very few. They've done research for decades trying to pinpoint specific genes for all sorts of different mental health challenges. And it has been a challenge. They're chasing their tails on this, and it's very, very difficult. Now, there is some amazing research around it that they've made some real great progress, but anybody that understands genetics knows that in general, even in physical health, it's the conditioning that you go through of lived experiences and the epigenetic mechanisms that end up manifesting certainly mental health, but even a lot of physical health. So we want to get away from this language, this medicalized language in mental health, and understand that we can do better. So we really need to instill a little less confidence in that existing medicalized system, and understand that we are looking and talking about what I would say are invented diseases. I say invented diseases and mental illnesses because if you compare something like borderline personality disorder to cardiovascular disease or cancer or diabetes, there was in the latter, there were people that either passed away or had some symptoms. There was a series of scientific research studies and autopsies and all sorts of great science that dove into the root cause. They identified the root cause, whether it was cancer and diabetes, the root causes of diabetes or health or heart disease with artery blockage and the plaque buildup and all of this. So that there was a lot of research that identified the root cause, and then there was medical interventions, medications and surgeries and so on, and lifestyle changes that helped identify how do we alleviate the symptoms, but also quote unquote cure, in some cases cure, like in cancer treatments. You can't cure diabetes, but in cancer treatments, cure the disease, the actual disease, right? Same thing with, say, just bacterial infections. So a series of experiments. They identify different antibiotics. Jesus, that's so funny. They identify antibiotics through a series of experiments to see the effects of those antibiotics on a bacterial infection. Then they cure the infection through that medical intervention. So if we compare that to something like borderline personality disorder or bipolar or any of these other diagnoses, people are showing up with symptoms and they're being labeled with an illness, disease, or disorder based on the symptoms, but not the root cause. They're not saying, here's what we understand is the root cause to those symptoms, and now we're going to provide some medical intervention to you to cure those symptoms. That's not what's happening with bipolar. They're just labeling that as a placeholder for the symptoms the person is experiencing. So a good example would be physical injury as it relates to the role of an intervention. You could imagine have an injury, you've got to go to a physical therapist, for example. Now, if you were in so much pain that you couldn't engage in the exercises the physical therapist needs you to engage in order to help yourself, you might take some pain medication. It would be awfully strange to say that you're cured yourself by taking the pain medication just because you don't feel the injury anymore. You still have to go do the work to help yourself physically. Now, it might be that you need to be on less medication or not the medication at all if you can't feel the exercises that you're doing. You can't necessarily resolve what you can't feel or experience. Same thing with medications when it comes to mental health problems. Sometimes you're being so medicated that you're not experiencing the mental health symptoms anymore. So then how do you work through it in a therapeutic journey? You have to be careful with that. And this is part of the dilemma of how we've medicalized things here. We want to make sure that we are experience or what did it do? And just doubling down on the idea that we're addressing symptoms, and if you go to a mental health professional and they diagnose you with some type of label from the DSM, you imagine going to a doctor and you have a runny nose and they say you have the runny nose illness, and then you say, well, I also have a headache, and they say, well, you have the headache disorder. And that would be awfully strange. And then somebody else walks in and you say, well, I have a runny nose, and they say, well, you have the runny nose illness, but I have a sore throat. Well, you have the sore throat disorder. I mean, this would be nonsensical. Obviously, there's a root cause to those symptoms that you're experiencing. So understanding what the root cause is would mean that they could actually treat you. And you could say, well, it's probably a virus. Well, is it? Maybe it's an allergen. But the allergen or the virus isn't actually causing the symptoms. There's a common pathway there, which is the inflammatory response of the immune system, which is causing those symptoms. So understanding the common pathway and the actual the mechanisms, the inflammatory response helps us both alleviate the symptoms, but also understanding the root cause, whether it's an allergen or a virus, helps the course of action. But in the mental health industry, a psychiatrist or psychologist, most of the time in the mental health industry now, don't understand the root cause that we're talking about here. They're just looking at it as symptoms. I'm going to do another podcast that we're really talking about the root cause, which is metabolic in nature. So it would be really much more appropriate to say you have metabolic dysfunction and your nervous system is conditioned in a way so that you're exhibiting behaviors that we label as bipolar, or that you're exhibiting symptoms that we label as ADD, but the actual root cause is the way your nervous system has been conditioned over time, and as well as the metabolic condition of your body. So the solution here is it's to resolve the dividing line here. There is no dividing line between biology and psychology. The long-standing debate, it's over. It's biological. You don't act, behave, or show up in the world separate from your physiology or your biology. Your physiology drives your psychology. So understanding ultimately, and this is what cognitive response therapy addresses, is the biological mechanisms, the underlying, the metabolic nature of mental health, as well as the way that your nervous system is conditioned over time to respond to life as you do now. Addressing the root causes will allow you to move beyond these diagnoses and actually move to living your optimal life. People still consider these diagnoses as permanent, pervasive. When somebody says I am bipolar, or I've been diagnosed with borderline personality disorder, they think that's it. It's a death sentence. This is going to be just the way that they are. But when you genuinely understand the root cause, the metabolic nature of it, and how your nervous system is conditioned, and really the overall physiological mechanisms that drive the symptoms related to your diagnoses, then we can get after it and we can work through it to move beyond them. That's what I'm so passionate about training mental health professionals and coaches in cognitive response therapy and the ARRAY framework, is because we can move beyond these diagnoses, get to the root cause, usher in the new era of mental health to empower people to live their optimal life. And this is what we're after. So really encourage all of you, please head over to elliottbarnett.com, engage in the certification process over there if you're a mental health professional or a coach, or if you're just someone that really wants to help others. Anybody can learn the science behind this. There is a roadmap that you can learn the strategy if you're willing to put the work in to really understand the science behind this and the strategy associated with all the intellectual property that I developed that created cognitive response therapy. It is a blueprint that you can follow with your clients to really empower them from wherever they are now to where they need to be to live their optimal life. So future episodes, I'm going to, again, double click a little bit on the predictive model, a little bit more of the research. I hope this was helpful to give you a little bit of the history of the mental health industry and help you understand how we got here and why we are still struggling to help people effectively in their mental health journeys. So it will be people like you that make that decision to engage in the certification process to become an agent of change in the new era of mental health. It will be all of you that pull together to usher in this new paradigm that will affect the true change in people's lives to help them live an optimal life. I'll see you next time.